But my first attack in 2010, I remember very clearly. I was on a holiday in Thailand with my sister and some friends. It took over my whole head. And it was I felt my head was going to explode. My eye was going to explode out of my eye socket. And I was just lying in the sand there. It looks like a gun.
Yeah.
It looks like a gun. And it actually is a kind of a gun with a trigger, with a small ampulla with Botox on it. And then they go through my cheek here. I must admit I've tried to get away from this earth at least twice properly. But yes, and I properly tried to kill myself.
Hello, everyone. Good morning, good afternoon, good evening from wherever you are watching. This is another episode of My Clusters Beyond the Pain. If this is the first time you're listening to the podcast, my name is Darshan. I suffer from cluster headaches. After a severe bout of a 10-month cycle in 2023, 2024, I decided to start My Clusters, a cluster headache tracking analysis app and a research platform. Today, very excited to have Christine, another clusterhead from Norway. Before we start, some important disclaimers. As always, this is not a medical podcast. We will discuss a lot of things related to disease treatments, etc., but we are not medical professionals. This is for informational purposes only. So if you are suffering from cluster headaches, pain, or anything serious, just generally don't rely on the internet. Go see a doctor or someone that's within a medical provider. Usually, as it goes with cluster headaches, we may also touch upon some sensitive topics. I know for both of us, like psychological health, anxiety, depression are topics close to our heart. If you are not in a good place, if you have any harmful thoughts, please contact your nearest emergency providers. I'll also include a link in the description with the links of suicide links that you can reach out based on where you are. Yeah. Having said that, Christine, very happy to have you here. I know we've been discussing recording a podcast for some time now. So glad the timing worked out. I know before we started recording, I think as it happens when two cluster heads meet, we already discussed quite some things before we started recording. But let's start with maybe a quick introduction. Can you tell us a bit about yourself?
Yeah, my name is Christine Fingard, and I'm a cluster head from Oslo, Norway. And we are podcast, what do you call it, colleagues. So it's a pleasure to be able to be a guest in this podcast. It's a fantastic podcast. Yeah.
Yeah, Christine's podcast is called again Clusterpodden.
It's Klasepodden. It's from the Norwegian word klasehodepine. That's the word for cluster headaches in Norway. So
Okay, let me see if I can get this right. It's a class of Hodopine,
Yep.
and the podcast is Clusterpodden.
Yeah, so it's Klasepodden. And I have
So,
both Norwegian audience and big Norwegian audience, and also an audience from abroad. So the episodes is in both English and Norwegian. So some are in just Norwegian, some are in just English. So yeah, it's a mixed language, lingual podcast, really. Yeah.
nice. I have listened to the ones in English. I think there was the one with your sister.
Yeah.
Yeah,
Mm.
yeah, very good. So for the Norwegian and English listeners out there, I'll leave a link to the other podcast as well. But
Oh, thank
going back to the start, so you have cluster headaches, of course. Can you tell us how long you've had cluster headaches? Do you remember the first attack you had? What was that like?
I remember my first attack. I have had cluster headaches since 2010. So it's 16 years. And it was, of course, episodic in the beginning because it wasn't even episodic. It just came one attack and then one other attack. And then so it was random in the beginning. But my first attack in 2010, I remember very clearly. I was on a holiday in Thailand with my sister and some friends. And we were going to this nature reservoir in deserted island out in the fjords there. And on the way on the boat there, we took a speedboat, and I had chronic migraines from before. So on this boat trip, it was banging. He was driving so fast, and the boat was just banging on the waves. And we were trying to stop him because everybody reacted on this. But then it released something in me. I started to get really heavy pain behind my eye and also in the back of my head, actually, because I think the migraines also was kicked in then. So when we arrived at this island, there was nothing there. Not a kiosk, no, nothing, just a big box of ice they had on the beach there. And I was in severe pain then.
What did you
Yeah,
think was happening?
I just didn't understand because it was nothing like a migraine, nothing like a migraine. It was took over my whole head. And it was so, I felt my head was going to explode. My eye was going to explode out of my eye socket. And I was just lying in the sand there, and there was some Thai guys around trying to put some ice on my head, and I just didn't understand. And I never had heard about cluster headaches before.
Mhm.
So I couldn't relate to anything else than my migraines.
It
So
doesn't feel like a headache when
no, it wasn't
you
like
know
my
what it is,
I
right?
I
Yeah.
told everyone around that this was totally different. It felt like my whole head was taken over by knives and it was burning behind my eye, burning just on one side, not on my migraine side, because that's on my left side.
Yeah.
But on my right side is the cluster headaches. So we didn't really put too much into it. We just thought it was a heavy, heavy, heavy migraine attack. And then a few months after, I had a new one, and that was even more severe. That was in Oslo,
Mhm.
and I was out helping a friend doing her business, and it was outdoors, and I suddenly got hit again. And it was a lot of commotion. I was just put into a car, and we drove home and put me in my bed, and I was just sitting there screaming of pain. And the difference is it's so different from a migraine because I wasn't light sensitive. I didn't even notice anything around me. I was just in such severe pain. And it was just here. It was just so severe. And I thought I was going to die. I thought maybe I had a brain tumor or
Oh,
something.
oh, yeah.
Yeah. It was really severe. So then we went to a neurologist, and she said, I suspect cluster headaches right away. She said,
Wow. Okay.
yeah,
That's
but she suspected.
Mhm.
And they were testing out different medications, of course, over a long period of time. And my proper diagnosis didn't come before it had turned chronic. So
wow.
that was 3 years after.
Was the time between that suspected diagnosis and the actual diagnosis? How long did it take?
3 years.
Wow. I
And a
think
lot of investigations and stuff in between.
the
So
process is also quite different, right? So here it's, of course, yeah, and then the timing also matters so much with diagnosis. I remember my first cycle, I didn't know what it was, of course, and then took a lot of Tylenol. But when you're episodic, I think the first few cycles usually don't last that long. And whatever you are doing at the time, you think it worked. So said the Tylenol worked. And then for me, I just forgot about it after that because then I had remission for a few months. I didn't know
mm,
what it was. And then I only got a diagnosis after I moved to the Netherlands. And I think that was because for me, luckily, a friend of mine who's a doctor in Australia said, yeah, sounds like cluster headaches. So I went to the GP, said cluster headaches. But the actual process that didn't take too long, luckily for me, was to eliminate all the other sort of reasons. So doing an MRI and eliminating any secondary causes
yeah, I
and
did.
really checking if it's, migraines or cluster headaches, checking for things like are you feeling restless, etc. What was the process like that? Was it like that for you? And what happened in those 2-3 years?
Well, it came gradually more and more
Mhm.
during the time from the first attack until the second attack, and then the time in between gradually just it it came more often and often, and at the end it was chronic. At the end, it was 1, 2, 3 attacks a day, every day.
They didn't
Yeah.
have the diagnosis of cluster headaches when you were still episodic.
Well, they kind of put a diagnosis on me. They said cluster headaches. It says in my papers cluster headaches, but it doesn't specify what type, anything like that. But they tried to treat me with the verapamil. I went through all the testing of medications during maybe the last year before it went chronic. That's when I started properly to get like trying out preventatives and trying different medications. That sadly didn't work on me, and I couldn't use verapamil because of the CG was hard. Yeah, hard.
Yeah.
Yeah,
There are complications. It can cause low heart rate. And
Mm,
yeah, for me, I went up to, I think was 640 mg at one point. This is 2022, 2023. And then
yeah.
the highest here is 720. I'm not sure what it is in Norway. And I know in some countries they go up to 1020, but here they don't.
I don't remember what kind of
What
doses it's
all,
on. Though I don't
what all
remember.
have you, what
Right,
all have you, what all have you been prescribed? What have you tried?
well, I can't remember all the medications I've tried, but I've tried everything from lithium to to verapamil to yeah, all different types of medications. I've been prescribed some. My medicine list is evil. I've been prescribed so many evil medications that it doesn't really work on cluster headaches. So I just
Especially the preventives.
well, yeah,
The preventives are all, like, I usually call them like heavy duty, but yeah, the evil term also I think is fitting right here, because verapamil is a calcium channel blocker, so it affects your cardiac
a hard rhythm.
if heart rhythm and can cause bradycardia. Otherwise, there's lithium, which is again used to treat things like bipolar disorder. And then I know here at least it's not something you can administer on your own. So you have to be monitored as well
Yeah.
uh, for how you react to it, for how there can be any adverse effects. Or there's prednisone. I think that kind
Yeah,
of just,
prednisolone I use prednisolone in cures,
yeah.
really high doses. I use it probably maximum 5 times a year just to get breaks
What
from
was that like? I have been suggested prednisone.
yeah,
But when I read about it, I asked some friends that were on prednisone, and then they said, well, the side effects people don't talk about so much. So there's the effect on your immune system, the effect on your sort of like all the other hormones, skin, like weight issues, etc. What was it? What was prednisone, the experience like for you?
well, I use it in short cures, so I don't get that type of side effects because I don't use it long term.
Mhm,
So I use very high doses in just 5 days for each
mhm.
cure, and then I wait a long time to next year. So I don't get like swollen or moon face, these things that they call with the previous law. But I do get high anxiety from them because it increases the cortisol levels in the
Yeah.
body. So, and cortisol is a stress hormone. So for me, with my psychological deficiencies and stuff, it's
I cannot
stress.
challenges. I don't see. Let's not call it deficiency. I think it's
Well, my issues.
don't I
Uh,
don't know any clusterhead that I know that has no form of anxiety.
no, it's true, and it increases that, so it can trigger stress and anxiety very much in me.
Mhm.
But it's you choose between something bad and something bad. You have to choose, make
Yeah,
a choice.
it's a
Yeah,
trade-off, right? It's like
sometimes when I'm on a
uh,
holiday, for example, I use prednisolone to be able to manage to travel and also to get some time off when I'm there. But of course, risk is last time I was in Thailand this year, actually. I actually admitted myself into the hospital to get some
no.
medications to calm me down because I had a reaction on
What happened?
the.
Can you tell us more? What happened?
I was on high doses, 100 milligrams of
Mhm.
prednisolone, and I didn't sleep. I didn't get to sleep, and I got really stressed. And I told my sister I was traveling with my sister. I said, like, I think I need help because I'm going to get the psychological reaction now. And so I was in front of the. I was before it actually happened. Something. But I called the ER there in Thailand, and it was super good service. They came right away, picked me up. We went to the ER. I got a bed there, and they gave me some calming medications shot in my bum. And then the rest of the holiday, I was calm and good. But I
I
needed,
know, I
yeah,
know I mean, at least like we've spoken about like this and like other things. And then I think like anyone that has it for a while, we have sort of our own humor and the way to deal with
yeah,
these
I
things,
know,
right?
yeah,
But what I want to highlight is like the other aspect of how even small things, like whether you are having attacks or whether you are in between cycles and episodes, even small things like planning a holiday becomes like a logistical nightmare, right? Like,
yeah,
what do I do
yes,
with meds? What do I do in case something goes wrong?
yeah,
What should I pack? How much prescription do I have? So my protocol right now is verapamil, oxygen, corn blocks, triptans, right?
yeah.
And then if I'm at home, then it's kind of like okay, but of course I can't live life at home. No one can just completely be at home. So then the further any plan requires me to go away, then the more planning it needs. So
More
if
panic. Yeah.
I
That's
am,
I go to this trip in Thailand with my sister, and we've been doing this for over 10 years every year. So we go to the same place. So I know people there. I know the hospitals there. I know neurologists there. I know even the Norwegian neurologists who usually go on holiday there. So I can get nerve blocks there, and so I'm safe on that trip. But it's more difficult to get if I'm going to somebody's cabin here in Norway, for example. That's more difficult for me actually, because then I don't know what I'm gonna meet. I don't know what kind of room I'm gonna have, if I can have my oxygen tank there. I have to plan everything properly. So I tend to spend a lot of time at home.
yeah,
Yes.
it's like the known devil, and
Yeah.
no, if I need to go somewhere really far away, then I plan that much ahead. So then I know
Yeah.
that it's a triptan. Or I've had I in my brother's house in India, and then my cycle started, and then I
Mm.
got oxygen there, and it was a 4:30 a.m. attack or something, and the oxygen cylinder just started leaking.
Oh no.
And
Oh,
then
that's horror.
I
That's
was
horror.
literally there, and I'm like, should I, give it 10 minutes with the leak, or
Yeah.
or safety, just turn it off and
Yeah, or
whatever. Then
save the oxygen so you have some more oxygen left.
yeah, exactly. And then, figure it out in the morning, get the technician or something. Or last year, I was on a gone block. I had triptans, but I started getting like 5 attacks a day when I was in Edinburgh. And I hadn't started verapamil in that cycle still. And
No.
then, so it was like you said. So then I was like, you know what? I'd just rather go back home.
Yeah.
What does your planning look like now? What's your treatment protocol?
My treatment protocol now it contains of oxygen, of course. I have it
Yeah.
close by all the time. It's with me everywhere almost. And I use Sumafricam for aborting attacks. I don't really have any preventatives because I'm a medical resistant person.
Okay.
So I've tried out everything there is, and the only thing I use now is lithium, but it doesn't work on my cluster headaches because I use it for another
Okay.
thing
And
a little bit later. But I also have something called I use nerve blocks, of
yeah,
course, and
must be the ganglion blocks or the
yeah, and I use the normal nerve blocks I have is the sunblock in front with the local anesthetics, and the gun and the long block in the back here. But I also get this SPG block, which is different. Then they have this
yeah.
apparatus. They go through my cheek right here.
Sure. Okay.
It's here, and they go through the skeleton with a cannula this long, with a needle like this
Yeah,
long.
I think I've seen this. It's a little like a
Yeah, it's like
gun.
it looks like a gun.
Yeah.
Yeah, it looks like a gun, and it actually is a kind of a gun with a trigger, with a small ampulla with Botox on it. And then they go through my cheek here. Of course, they put the local anesthetics before
Mhm.
they do it. and it's done with a computer system, which I'm attached to, and the gun is attached to, and they can look at a screen of my brain.
Wow.
Yeah. So it's very precise way of blocking the SPG center. The SPG blocks that the old ones that goes, or the normal ones that goes through the nose here,
Yeah.
is not very precise. It's not precise enough at all. So this
No.
is
And
project, but it's a compassionate use off-label project. Only 12 people in the whole country gets this treatment actually now.
I was
Uh,
just about to say, and I haven't heard of any cases outside of Norway that this, like the SPG.
They've tested it out some other countries, but not as a treatment, just as in the research project. They're assessing the research on this now. So we are very excited that the project is closed now. The test group, which I'm not in because I get Botox every time,
Mhm.
but the test group for the research, they get 50% of them get Botox and 50% get placebo. So, but that's finished now, so that's not on anymore. So they are assessing all this research material they have now, and hopefully it's going to be approved. Hopefully SPG in both Botox and SPG is going to be approved.
Yeah, fingers crossed. So you said SPG, so that's the sphenopalatine ganglion, of course.
Yeah,
Greater occipital nerve. What were the
yeah.
other? You said this is.
That's the
Uh,
supraorbital nerve going over here. The nerves goes like this.
yeah.
And if I block here, I also block here, and I
Is there,
block
is
back
there any
here.
part of your head that is not blocked?
No, no, everything is blocked, and blocked inside the head also. I'm totally blocked off.
No, I have nothing to block to begin with.
I'm totally
So
blocked.
so
Yeah.
supraorbital nerve. You said so. The sun block, is that also Botox?
That's not Botox. That's Marcaine, local anesthetics. Only local
Anesthetic. Okay.
anesthetics on the outside of my head, and
And
Botox inside the SPG center.
inside. Okay. But
Yeah.
the greater octagon blocks are also then anesthetic, no corticosteroids.
I don't use cortisone steroids because my stress.
Yeah, of course.
So I can't use that. I just use the cures when I need them. But I can't have cortisone in my body all the time because then my stress level will go too
Yeah.
much up.
Is even in that small doses.
Yeah,
Okay, interesting. Yeah, I hadn't
it's
considered that actually. I think when I checked for the gone blocks, they only said uh, there could be long-term side effects of repeat gone blocks. It could be what's that thing where your bones get weak, like osteoporosis or
yeah,
something.
well, yeah, with the bones.
But yeah, now I'm like luckily like getting them only. So now it's kind of like when my cycle starts and then I start back on verapamil and on gone blocks, but can't imagine like if it's chronic, like you have to keep getting, like you said, blocks here, blocks there, and then
Well,
then
I'm actually very lucky because I did a smart thing to say it like that, and I was lucky. I have a neurologist that, of course, has this system. She puts blocks here, but she can't do it all the time, and I use local anesthetics. It goes out after maybe one day. I
Mhm.
get 1 day relief, and then it's over. So I go to this neurologist. I travel like for an hour to get there, once every month, and then 1 day off. And that's worth it. But I thought it wasn't enough. So I talked to my general physician.
Mhm.
He went to he agreed to go to a meeting to get taught up by my neurologist to put gum blocks or blocks.
Oh wow, okay.
Yeah. So he came to the hospital there. He was taught up, and he lives 5 minutes away from me. So now he can do, or it's been a long time, but he can put gum blocks on me 5 days a week. So I'm probably there about 3 times a week,
Oh wow,
just to get a break. To get some,
that is.
sometimes they work properly, sometimes they don't really work. Yeah,
No, I
but
think
most.
like just having a dedicated GP goes such a long way. Like
I just had to do it.
for those of you that are only on audio, yeah, Christine's pointing to the Clusterbuds t-shirt. Yeah.
Yes, I have a
Mm.
Clusterbuds. New Clusterbuds t-shirt on.
There's a Discord server and 24/7 peer-to-peer support. There's people there from all over the world, so you'll always find someone online. Uh,
Yes.
It's mostly in English, but there's channels for Dutch, Spanish, and there's some speaker of some language that you probably speak.
It's so
Uh, but
fat. You can go into this variety. The whole menu there is fantastic.
yeah, exactly. There's different channels. There's information. I think the nice thing is also the lounge, right? So if someone's in the lounge and talking,
Make their photos, art, everything. It's a
so
very nice, it's a super nice community. So
absolutely. And
yeah,
we are both part of it. I will leave a link in the description. If you are looking for, like support, I think the biggest thing with any chronic disease and all, like obviously cluster headaches, is you can tend to feel like you're going through things alone, and
you
it's
feel totally deserted. The whole world is deserted. You just feel so alone. Yeah,
and with cluster headaches, like even with people close to you that are supporting, there are times like during an attack, like you can't, you either don't feel like explaining, or you feel like like you've explained too much and some people don't understand. But I think the first thing about community, I think that was like the best part of it, and still is, I think, is that there are other people that understand you. Like you don't have to
not explain anything before, and
explain. If you say, we could meet for the first time today, and if I say I'm episodic 9 years, currently in remission, last cycle was in like July, September, getting shadows now. I don't have to explain more than that to you,
you don't
right?
have to explain what a shadow is, for
Yeah.
example, or what remission means,
Yeah.
or that you're tired, or you don't have to explain it.
So I think that's the best part, that there are people there that are on their first cycle. There are people there that are veterans, let's call it. There are, I think, a lot of advocates, like heavyweights, that did a lot of heavy hitting for cluster headache awareness, like back in the 90s, I think, when things were still not. I mean, there is a lot we need to do about awareness, but back in the 90s, I think it was even lower.
Yeah,
So,
hideaway. It was kind of a hideaway disease, and it was like only men who had it, and wasn't really known at all. It
it's
was
known by different names. I think it was called like
Horton's,
Horton's neuralgia, Horton's headache.
yeah,
Uh, then,
histamine headaches.
yeah, that's my favorite, cluster migraines.
Yeah, that's an most hated one, isn't it?
Yeah. Then cluster headaches. But
Cluster-
I'll leave the link there. Do check it out if you want support, if you want information, if you want to talk to other people. We have monthly meetups and Clusterbuds. Yes.
Yes.
Going back to now that we're here on the topic, right? So, of course, you do a lot of advocacy yourself. I think you're one of the most active people I've seen on social media, posting about awareness, posting about other people's stories, challenges, victories, struggles, whatever it is. And you have your own podcast as well. So how did you go from, like struggling yourself 3 years for a diagnosis, being chronic? What made you become an advocate? What made you become a sort of a patient champion?
I think you're a champion. I think my first, I've always been very outgoing, wanted to meet
Oh,
people.
you? Oh,
Me, no. And I have a lot of humor also. So I tend to get in contact with people easily. One of my first things that I did that was actually international was in 2018. Well, I started the cluster group way before that. I've always wanted to start an organization in Norway for
mhm.
own heads. So I was thinking about that in 2016, around there, about 3 years into my chronic illness, where I had started to get everything in order with my protocol and everything. And I wanted to help other people. Seriously, I just wanted to help other people, and of course, got into contact with Clusterbusters quite early.
Mhm.
I got a lot of help from them with different things, and I was invited to a conference in Paris in 2018 where they made the declaration of cluster headaches for Europe,
Mhm.
and I was the representative for Scandinavia there. So that's when it started properly with the awareness thing. Before that, when I had the groups, I had a cluster group called Cluster Headaches Norway for a long time in Norway. And that was quite early. And that was also an international group. But in 2018, I had a very traumatic experience in my life. Didn't have anything to do with the cluster headaches, but it was a very traumatic event that happened in my life around 2017, 2018. So I actually had to cut out the group. I just had to stop everything. I just had to concentrate on my mental health and whatever had happened to me then. So that's when I got closed off from the whole community. I just went into myself and I just closed off everything.
Mhm.
And I was kind of away from the community for some years. And then I had a comeback
Yeah.
in 2021, I think, something like that. Started to get into the groups again and started to work on. I always wanted to help other people with this condition because I had heard about cluster headaches when I got them. Just that, what is cluster headache?
Mhm.
So, to spread awareness and make through my profiles and through groups and be active on the internet. That
I
was
think
my
the journey is quite similar, right? Like first is the struggle of I don't know what's going on. Then
mm,
you get a diagnosis and there is a name. So you
yeah.
have momentary relief. Okay, it's just
Also,
there's a name.
things done
Yeah.
by it. Yeah.
It's not a tumor, it's not a stroke. I'm not gonna die. So okay,
Mm,
cluster headache. What do we do?
yeah.
Uh, okay, so
What do we do?
and then you go back to sort of like, okay, so yes, there
Yeah.
is a name, but there's no cure. There's like a lot of off-label medications, and then you come to what you're saying. Like there's a lot that needs to be done.
Yeah.
What are some of the like common themes you see around awareness, or is there any misconceptions that you see online, or any specific things about awareness? I mean, I can start you off with an easy one. I think like the confusion between cluster headaches and migraines, especially for
That's what I was thinking about.
okay, go on.
Because we've all experienced it. Many of us have both things.
Okay.
And I had migraines since I was 20 in my early 20s,
Mhm.
and it chronified for took many years until it went chronic. So it's common that it's misconceptions between
Can you? I
migraines and
know
headaches.
this is probably an irritating question, but just so if there are any first time listeners out there, if there are, is there is someone out there that still is confused. So since you have migraines and cluster headaches, can you tell our listeners from an experiential point of view
Mhm.
how you experience a migraine, how you experience a cluster headache?
I experience migraine coming mostly on my left side of my head and
Mhm.
trumping hard pain that is more deep, trumping, heavy. I get very light sensitive. I get nauseous. I need to just stay inside. I use these caps here, these
Mhm.
ones. They are like cold caps that I put on my head.
Yeah.
To cool down, I lay in a room. I don't need to use oxygen, of course, when I have a migraine attack. It's
Do you
not.
use anything for a migraine?
Yeah, I use Emgality and I use sumatriptan.
Okay.
Yeah,
Emgality is the injection. That's a
yeah,
CGRP.
I
Yeah.
use once a month, and I use sumatriptan for acute treatment.
Okay.
Also, if I
Uh,
get status migrainous, it's if it lasts for over 72 hours, then I use prednisolone to try and cut it off.
okay.
Yeah.
I've heard
But I'm
migraine
so
can last.
affected I'm not so affected by the migraines anymore because Emgality works really well for my
Mhm.
migraines. So basically, I don't really think about it so much just when it comes on.
So,
The
so
attack comes every fucking night. So it's
don't call it the beast for nothing.
no,
So
no.
migraine to summarize is, so you're saying it's more deep and
More
it's
deep
more,
and it's behind my and it's like in the front here, and it's also can be pain on the top of the head. It's like more thrumping inside the whole head.
yeah.
And but the cluster headaches is sharp. It's I can kind of compare it when I'm explaining to people. People say like it's like painful, like childbirth and blah, but it's too big to kind of consider.
Mhm.
If you have a loose tooth and you pull it out, and the nerves there are, you can actually play
Because,
strings. It's like playing with those nerves just behind the eye. That's the pain. This is sharp, stabbing kind of
yeah.
electric kind of pain. Yeah.
And
So
what do you feel like? And maybe I'm fishing for an answer here. So you said photophobia, and you need to cover your eyes during your
yeah,
night.
before I get an attack, that comes before I get an attack. I can feel it come. I get very light sensitive before an attack comes. If I'm awake, I can't notice that when I'm in bed. It's dark, but when it hits on very quickly. So for me, light sensitive and all these sensory things around it, many other patients are affected by it, and totally understandable. But for
Mhm.
me, it hits on so quick that I don't really recognize anything around me. I can be in a room full of people and I get an attack and I don't even notice they're there.
I mean, I don't
Uh,
have like light sensitivity or sound sensitivity. So,
so,
but you do feel restless. That
yeah,
is, I think, also one of the biggest.
yeah.
Uh,
I'm not. Yesterday, I had a little bit of a bad day because I was arguing with everybody around me. And I was thinking, oh, it's something wrong with them and something wrong with him. No, it's me. If I'm arguing with that person, my boyfriend, my mom, my sister, my father, and they're not all.
they're all wrong.
It must be me. So I was too tired yesterday, and I was pushing myself too hard yesterday, and I had to take a round call to everybody and say I'm sorry. So,
Like I saw this thing somewhere. It's like when you're driving, everyone faster than you is an idiot. Everyone slower than you is a moron.
yeah, yes, it's like that. And maybe it's you.
But again, I think that I'm sure there have been situations where there are, like I think especially on the internet that you have to argue or maybe educate people, and then you're either like in getting that habit, or and I know we spoke about like anxiety and things before, but I think the mental health burden, the psychological burden, and the effect this sort of disease has on us, it's not measured. It's not the same on everyone, from anxiety, depression. I think if I look back at myself, like a strong imposter syndrome, uh,
Mhm.
like I'm on anti-anxiety meds now for like a year. So I'm on like SSRI. So then I have to worry about what other meds can I take, and the
Me
inter.
too. I have the same issue because I have a
Yeah.
bipolar diagnosis. I have
Mhm.
bipolar 1, which I got way before I got cluster headaches.
Mhm.
So I was actually using lithium before I got cluster headaches. This is my one of my ground
Oh,
multi
okay.
medications I take because it keeps me in check with the bipolar.
Mhm.
But I have to use antipsychotics sometimes.
Okay.
So because I don't tend to get depressed, I get anxiety and I get
Mhm.
so called individualized what do you call it? I forgot the word. Demoralization is a typical thing. It's
Yeah.
a psychological state that many chronic pain sufferers comes into. And my bipolar is tending to get to the manic side,
Yeah.
much more than the depressive side. I don't get depressed where I lie in bed for days and just feel like life is not worth anything or stuff.
Mm-hmm.
When I'm depressed, I get comes rapidly. It's kind of dangerous.
Mm-hmm.
It comes very rapid, and it's very demoralization. It's loss of hope, loss of everything, anger towards
Your depression
myself.
is also like a cluster attack. It comes suddenly and intense.
Yeah, yeah, I know. And the danger with the demoralization when you feel you're not depressed, but you're so anxious and stressed. You don't want to. You just want to don't live anymore. You get, and that's where the suicide danger is very much for me and many other chronic patients when they get into this demoralization, individual demoralization.
You did you notice any period when this got especially like bad for you? Because
Yeah,
yeah, can
I've,
you want you
I,
want
I I must admit I've tried to get away from this earth at least twice properly.
wow,
Yes.
you wanna talk about it? Is that too personal?
Well, I don't want to say how I did it, but go into details like that. But yes, and I properly tried to kill myself
What
uh,
was
because of course, I wasn't in the right state of mind then. I thought that it was a combination of me just coming to this state where I was so demoralized that I thought like my humor was so dark at that point that people around me reacted on it. I was joking about suicide. I was joking about my conditions.
Mhm.
I was making these harsh, very dark humor joke. It wasn't humorous at all. Like, hey, yeah, you can just jump up a cliff, and when I
Yeah.
come home, I'm just gonna hang myself,
And
when that's
inside you're thinking, oh, that would actually be mean that I'm not in pain anymore.
it would mean that I'm not a pain anymore. I'm not a burden to everybody else, and
Mm.
life is gonna be less empty. It's
There's
totally,
the yeah, there's
yeah,
the dark humor. Yeah.
yeah. So, so I've been to therapy for many, many years now. I go to a psychiatrist. I don't go to a psychologist. I go to a psychiatrist, which knows medications as well. So I go to both cognitive therapy and trauma therapy.
Mhm.
It's traumatic to experience attacks every day. It's
It's an
traumatic.
assault on your body, on your senses, on your
It's like an assault,
feelings. Yeah.
like you being assaulted every time it happens.
Yeah.
So it took me about 4 years in the system after I was admitted in 2020. Had 3 weeks in the psychiatric ward, actually, where I needed to have time there. And it was one of the best times of my life. I really did. It was really nice there. I actually sometimes missed it, believe it or not. But it was a safe space for me. I got the right medications. They were kind there. There were people listening to me. I had a good psychiatrist that
I was just gonna say that I think there are like people that take you, listen to you, pay attention, take you seriously after
mm,
years of maybe like having to shout
yeah,
for care, for awareness. Then I can imagine that it felt nice.
it was so nice. I felt like a baby being taken care of. And I was there only 3 weeks, but
Mhm.
big change with my psychological state of mind.
Mhm.
Then I was very demoralized when I came in there. I was just like, yeah, fuck everything. Fuck.
I think that's the part, right? Like harmful thoughts, suicidal thoughts, they don't just automatically get them. There are like you have the, like fuck the world, fuck everyone kind of like you feel like it's you against the world that no one understands. Then possibly moves on to like passive thoughts, like you're not actually thinking of doing something to harm yourself, but you're like,
Mm.
yeah, it wouldn't be the worst thing actually. And then if you don't pay attention to that, then goes to active suicidal thoughts.
Just I'll stop there. And I was also very good of hiding. I had a mask on always.
I think
I
most
was
of us are.
hiding my clusters. I was hiding my my bipolar, and I
Mhm.
was just pretending to be okay. But inside, I was totally wrecked. So, but my family, they tried to get me help many times, but I resisted. I was fine.
Yeah,
Everything's fine.
fine. It's just a
Yeah, I
phase.
was scared
And
of my son. He wasn't that old.
Hmm.
I was scared maybe the child support services would come into the picture, stuff like that. So I just put on a mask.
Hmm.
In After I was admitted in the psych ward and I came out, that mask totally fell off. After that, I decided to be open about everything and also my bipolar. And it's been very
Nice to
helpful.
hear. Yeah.
It's been very helpful to be open about.
How do you deal with it now?
Now I have strategies that I use. Very good, safe strategies that I've been it's still working. It's always work in progress. But
Mhm.
I have proper written plans. Actually, there's more. I think it's more important than my medications. Actually,
Yeah.
written documents that I change with triggers, with what can happen if I. So it's kind of like preventative plans for
Hmm.
future maybe bad events.
Can you give us an example of one of these strategies?
Strategies is like I have a box system, for example.
Okay.
To my box system, and many people have this, but I use it properly. I have imaginary boxes that I have in my bedroom. They're
Hmm.
not there. It's imaginary
Yeah.
boxes where I have different sections where I put thoughts into these
Hmm.
boxes, I take them out again. So I don't carry everything. That's just one strategy. I have many, but
Like just
it's
carrying
working.
your emotional baggage around.
Yeah, exactly. And I can take it out when I'm at home, but I don't bring it with me outside with other people. I can leave the problems at home. Yeah.
You're in control.
I have control. I'm very good control now, and I hope I can continue having it. But
Yeah.
I've been in good control for over 5 years now.
Yeah. I mean, also a lot of times, like with even like anger or when people have like fights and, like what you're saying, and it's like the emotions have control over you. But with this strategy now, it's like,
Yeah,
yeah, I find that like with therapy, some of these exercises are like, like the thought records in call CBT or the like anything with journaling or just
journal
taking,
it's a very good thing, and
yeah.
also to record sleep patterns. For example, I don't have a pattern, but I actually try to write up my sleep so I can get some of the sleep back in the daytime that I lose in the nighttime. And I
And
also have developed a crisis plan for my family and
okay.
my friends also, which I was been given out, and I've signed it myself in the
Yeah.
period I'm actually well, when I'm in a good state of mind. And I've signed it. It's actually a document that is bound. So what they can do if I totally go off the charts, then they can call 113. It's an emergency number in Norway. They're allowed to call my doctor. They're allowed to do all these things they're actually not supposed to be doing. But
Okay.
I've written my signature there. So I've given it out. My son has it. My mom and dad has it. My sister and some of my friends. So they know what they can do if I'm there,
Yeah.
where I'm
Because
totally
I think,
demoralized, or just say goodbye.
I mean, I think it makes it's smart to have plans. It's smart to have like backups. And I think like after a few years with this disease, it becomes second nature
Yeah.
to always have that at the back of your head, right? It's always
I
when things,
sometimes have to bring my written plan with me in my purse.
yeah, when things attack, what's going to happen?
Just to
How,
remind.
yeah, how bad is it going to be?
Yeah.
And at some point you're like, like, okay, I'll get used to it. If it's the same kind of intensity, same number of attacks, it's fine. But then
Mm.
it doesn't work out like that. And then I know that you need to have a plan. The part about therapy, I think I cannot also stress highly enough. Like one, I think first of all, everyone should go to therapy. I think it's as adults,
Or I almost, yeah.
we go through a lot, but especially with cluster headaches, any kind of chronic disease, I think it's been proven, right, in multiple papers, like psychological comorbidities, increased anxiety, increased depression, social isolation,
It's
anger,
obvious that I
suicidal
need
thoughts.
psychological
Yeah.
help. It's obvious.
And I'm almost like we kind of did a small study with some medical students, and then we said, like an integrated care approach where
Mm.
like you get a cluster headache diagnosis, I think you should also get 2 free therapy sessions or something that we don't think fixed. But if
We're actually working out this plan in Norway now. The government is working on making this kind of plan for cluster headache patients, like they have for stroke patients, for patients. This is a patient rundown, how they
Mhm.
come to you. So they want to put it into this kind of box where you can get like where they say that you have a right to have a neurologist, you have a right to get these medications, you have a right to have a psychiatrist, for example. But I don't know what's going to contain yet.
Yeah.
So I'm pushing our organization here in Norway to put in that the point that where we need psychological help. That's very important.
And the kind of education and awareness that is needed with the psychologists and psychiatrists as well, right? I think the difference I can see is with one that I was doing the CBT with, but didn't know much about the disease versus my therapist now that took an effort to read more about cluster headaches. And then, like we were considering EMDR at one point, and she said, if you're out of a cycle right now, and I was reading, like, if we can do EMDR, there might be a small risk. So unless it's absolutely necessary, let's stick to like,
Yeah,
either,
I skipped DMR because I was afraid to get attacks from it.
yeah.
So
So, but there is like
cognitive
ECT,
therapy.
right?
Yeah,
The acceptance and commitment therapy, or just like you said about the hospital, like just having someone that takes you seriously, understands what you're going through,
yeah.
and the uh, like I think people that are healthy but sometimes get sick, so people that don't have a chronic disease won't understand how like everything becomes a challenge, right? So then,
Everything was a challenge. Just to go out to the grocery shop, it's just like I need to plan like maybe a couple of hours ahead, even if the shop is just 5 minutes away. Yeah, so I had to change, maybe put on a cap. Takes a while. Then I get confused about something because I forgot something, and then it takes
holiday,
like always being a retired
yeah,
person.
things like holidays, like Christmas and things, and it's
Yeah.
usually like so many
Now I'm
sales.
turning 50 and everybody's expecting me to have this big party. I'm not like,
Like,
no. My boyfriend said like, Nate, we're just gonna elope. We're going away.
yeah,
Yeah, why not?
somewhere you can take your oxygen, take your triptans.
Yes.
Yeah.
Yes. Yeah, getting attacked in the middle of birthday. No. So it's
Uh,
not a big
do
celebration.
you see any like specific cases or any examples that you can highlight maybe of, like the psychological health, how it can affect someone, how it can help?
Well, I can only use myself as an example.
Mhm.
And I mean, I have bipolar disorder from before, but that was actually quite in check until I got my headaches. Then it was two flare ups, two different diagnoses that just flared up, and I think it's I don't know. The research doesn't say that it's a proper link between bipolar, especially just like only bipolar headaches. But my psychologist calls it comorbid diseases,
Okay.
and most of my neurologists also call it comorbid diseases. But I think it's more comorbid states.
Mhm.
You know, whatever you call it, it affects it does affect each other.
Yeah.
If I get into kind of more manic episode, then my cluster headaches comes up. I got more attacks. So the most important thing for me is take medications for bipolar. That's kind of the ground thing.
Fine. Yeah.
Because if my psychological state of mind is not there, then I can't do anything good. But if I have that in order, then it's so much easier to manage my cluster headaches. So if I'm psychologically stable, which I've been now for the past 5 years,
Mhm.
and also many years before that episode I had then when I was admitted. So that's my baseline. That's who I am. So I can very easily feel like now when it's springtime, it's very typical for me to go a little bit up with my bipolar,
Mhm.
going hypomania. So then in the springtime, I use antipsychotics just to calm me down, just to be on level. And then when the summer comes, then I can gradually stop them.
Yeah.
So I'm not unstable now because I'm medicated
Mhm.
with medications I use, and not too much, just the small doses of in a very short period of time with psychotics in the springtime.
Yeah.
helps throughout the whole year. So I managed this very, very well, but also especially with good help from my
And I
cook.
think the bottom line, what's so important in what you said is I think you need to be in a good space mentally. You need to have a
As good as
strong
possible to manage the
sense of
cluster headaches as
managing
possible.
ethics. I think a
Especially,
lot of
it's like
times,
building a house. So, you have the house and you have the ground here.
yeah,
This lithium, this is lithium for me, and all the other medications and things comes here.
yeah,
This is lithium, then oxygen, then sumatriptan, and the others.
okay.
And of
Yeah. I
course,
mean,
yeah,
in
the
between medications, I think for me the foundation. I mean, I am on anti-anxiety meds, SSRIs now, but I think the therapy itself is the foundation. I think
the
like
therapy and stuff is the
yeah.
most
So for
yeah.
me, the way I look at it is that there's the apart from the relentless pain, the other thing that cluster headaches takes away is our control because
Yeah.
you don't know when the attacks are going to come, and you get nighttime attacks so you can't even sleep properly. So it starts interfering with different parts of your life. So I think for me, the worst part was when it started affecting my life in such a big way in between the attacks. So
Yeah.
I had to quit my job. I wouldn't leave the house for 3, 4 days for the fear of the attacks. Like, just order in food, don't clean the
I
house.
didn't sleep for many years because I thought I was just just getting away from the attacks by
Yeah,
not sleeping. So I was insomnia for many years, and that also triggered my bipolar. So
exactly. That
that's
affects,
it.
and probably like, yeah, I mean, if I did that for longer, like to fuck my sleep up and not, I was sleeping on my couch for 3 months because I said, okay, I'm not going to fall asleep. And then just like with
Mm.
the TV and then don't sleep, don't sleep, don't sleep. And then kind of just,
Was making so much good art that time at that period because I was awake 24 hours a day. So I could and I was a bit
do
manic
like,
as well.
yeah,
Yeah, and I was totally worn out and had about 12 attacks a day.
wow. But
Yeah.
I think also, so in the long term, of course, that's not smart, right? Because then
Yeah.
out of your psychological
Was
strength,
damaging. That was
yeah,
damaging to not sleep.
and that's kind of a slippery slope. And that's why I think like as much as cluster headaches take control away from our lives, like I think just having that, like have therapy and having that focus on like, okay, let me do what I can in between the attacks
Yeah.
and get that little bit of control back. I think that
Mm.
helps in dealing with them better. I mean, of course, it's not like one size fits all. I mean, I can sit here and say that in a remission period, ask me, yeah,
Yeah.
ask when my cycle starts. But I think I cannot advocate highly enough for like getting any kind of help to deal with anxiety, depression at the first sign of things.
And I also got help to get a system in my house around just around medications where I have them, where I need to have it tidy all the time. I need to know where everything is so I can
Yeah.
easily get it. So I moved from a big house to a small apartment,
Mhm.
actually just to have a smaller space so I could actually navigate better in my daily
Yeah.
life. Not
You have a
course, not so many places that I can misplace things. Just have order in things and order in my medications, like almost like a pharmacy in my room.
the Japanese would love you. The Japanese systems like Kaizen and like how extremely organized there. I think there's like something called the SS
Oh,
triple S system, something.
yeah,
Uh, a
also
place for
OCD.
a place for everything and everything in its place. I think that's
Yes,
kind of like
yeah,
what
and I need to have it like that. I also need to know where my keys are because if I start if I get confused and I'm tired and I know an attack, then also stress triggers attacks for me. So as little stress around me as possible, both in my own stress and other people's stress.
but
I
also
need
control,
I need
right?
to know if I'm invited to somewhere. I need to know not the same day, not even the day before, but maybe a week before. I need to prepare for things. So sudden messages, sudden things I have to do. You have to come right away, stuff like that. triggers stress in me.
Mhm. And control. I think the like small things like that. You're saying like knowing where my keys are, knowing where the pills are, how much I have, knowing my emotions are in that imaginary box in my room,
Yes.
and I'm not gonna take it out. I think these small things add up. Talking about like other like things that may be difficult in relationships, of course. So you have a, let's say, unique arrangement. I don't know if you want to talk
I
about
have a
it.
unique arrangement with my
Yeah.
boyfriend. Yeah,
I
we've
don't know
been
if you want to talk about it.
for my many, many years. We've been together since I started the SPG block, and that was in 2019.
Mhm.
So we've been together since that, and we lived together for a while. But then I had my psychotic breakout in 2020, and I was admitted to the psych ward. And then we decided not to live together. But he never ever gave me up. He was there in the back all the time, and I was blaming him. We were moving from the house. I left everything, and I
Mhm.
was so, and he just found me. He just found back to me, and he must love me very much. I think because
Yeah.
I
Yeah.
said we can't live together, and he was like, okay. And then so he moved to he lives in a different city, not far away. But we talk every day, maybe 5 times a day on the phone. This time, and then he comes here. I think he comes here maybe every second, third week and stays for a couple of 3 weeks. so, but he's also on 100% disability because he suffered 4 brain strokes 3 years ago. But he's doing good. He's doing good. So, but at least the good thing is that we can
From
actually
what
see each other when we can, and he's not like he doesn't have to have a job there. That
Mhm.
we see each other whenever we want.
And then from what you said, this is a system that works for you. And
So it works very good for both of us, and we're very happy about it actually. And it's exciting to see each other, and we don't have to have the everyday arguments and all these things we slip.
and support, I think then you have mentioned before, like of course the two men in your life, your partner and your son, of course.
Yes, I had
Uh,
actually three men in my life: my dad, my son, and my
how
partner. Yes,
how are they been instrumental in your support?
they're
Uh,
probably the best, most supportive. My whole family, and especially my son is a very special. That's
mhm,
very special because he was 7 years old when I had my first attack, and I'm a single. I've always been a single mom,
mhm,
so he's been experiencing me since he was 7 until now. He's 23 years old now. He's a big man now, and he's studying product design and architecture in a very good college here in Norway.
nice.
And I was good at calling help, prevent him from seeing the worst things in
Okay.
my yeah, it's the worst attack periods and stuff like that.
You did you
Parents,
ever actually sit down and talk with him about what you're going through and what age was
yeah,
he
yeah,
when
yeah. We talk
how old
about it.
was he?
Yeah,
How old
continuous.
was he when you first said, okay, now I need to tell him and not protect him or
I
uh
told him right away. He was 7 years old and he was
oh
quite
wow, okay.
outgoing. So I sat down with him and I said to him, like, Mama has. I told him that it's bad migraines in the beginning because he knew that I had migraine. So I said it's been becoming worse. So you have to spend some time at your grandparents' house and your auntie's house. My
Mhm,
sister, who's my best friend, and and she has a son and a daughter that is same age as my son. So it's kind of a El Dorado for them at my
mhm.
grandparents' house. My sister lives close by there. So I've gotten a lot of help from my family. Without them, I don't know how it would have gone,
Mhm.
actually. Just, yeah.
How
But
is how is I mean I know you've mentioned so many times like how supportive your son is. At what point did you notice that, he started really understanding how does his like if there are other sons listening, like
yeah,
how they can support
I
uh
think around when he was 10 years old, he started to help me more. He understood that. Then gradually we had introduced him for what cluster headaches was, and showed him the oxygen tank and all these things and the shots and everything. So
Mhm,
he wasn't really. it wasn't one intervention where we sat down and said, now mama has cluster headaches.
Yeah.
It went just gradually. So now mama has gotten an oxygen tank because of these pains. Maybe you can try it. And we tried it and we played with it and did it kind of in a funny way. And we had pe- situations where he has carried me out to the ambulance.
Mm.
That's very nice for his little kid to do, but we didn't actually have a choice.
Mhm.
And also where he has tried to help me, where I sat with my head with ice and he sprayed the whole bed bathroom full of water, tried to help me when we lost everything. It was water everywhere and stuff like that. So it's kind of, when we look back on it, it's kind of funny to think about it. But in that situation, it was kind of critical and
So,
not the best situation for him, of course.
mhm.
But hey, that's his life. That's how we had it in my house. I compensated with giving him like open house for all his friends. We had 2 floors before,
Yeah.
so he had a kind of a small, oh, 2 big rooms downstairs with couch and television and everything for himself. So from an early age, I was actually always open the house for his friends to come.
Mhm.
And they all understood. And I talked to the parents, I talked to the teachers at the school about this. So the whole community around me knew about my condition and knew what it was about. So I could also call neighbors and ask, can we come over to you? Because now I'm gonna have a really heavy night. Can you sleep over? Of course, yeah. So the community, the close community around and family and the community around it's so key. It's been so key for me.
Yeah, I think when I had my worst period also, it's the small things that, like family support, community can do that means so much, right? Like small things done consistently, knowing you can rely on them. Like I had just few friends that would just, wouldn't not like concerning, oh, what are you up to? But just be like, hey, I'm just
Mm.
gonna come over to yours and we watch a movie together. And like what's
And I had my sister. My sister is like, and she's amazing. She lives 5 minutes away from me. I could call her now and say, "Oh, I feel really bad," and she's like, "Okay, I'm gonna go for training now,
Mm.
but in an hour I'll be at your house."
Yeah.
She's just like that. It's every time. It's never no. It's never no. It's always a yes. Okay. Yeah.
What is how's the other, like if there are other listeners in Norway, like is there like other support systems or other places they could reach out to?
Well, we have an organization in Norway called Hodepine Norge, Headache Norway. It's called translated, but it's more of a migraine
Okay.
organization. Where they have other attacks and other diseases
The
around. Right?
Yeah.
They don't really focus enough on us at all, and it's been a problem all along. So we don't have a proper organization in Norway for helping cluster
So
patients.
what's your support system outside of family, community? What do
Uh,
you do?
you guys, well, the communities and yeah, and also have good friends. Yeah.
Yeah.
I have very good friends. I don't have many friends. I have many acquaintances called friends. I can't take on too many friendships because I don't have the capacity to fill it to
Yeah, it's an
fulfill.
energy commitment.
Yeah, it is. So I have very good solid friends, both from childhood and also newer friends. I have my boyfriend who has a lot of friends, and I have my sister who brings me into everything she does, and she is very social, and so I have a lot of people around me that I can just call, and I'm lucky. I'm very lucky. I'm not the
And,
lonely.
and you still find time to do all the advocacy, like all the posting, and I've seen you like on
That's
the
the hard. That's something I can't do.
how, I, I don't know how you do it. I don't know.
I'll have to.
And the class supporter, of course. So can you tell us more about the podcast? So if someone is curious about the podcast,
Yeah. We started, me and some other people started an idea for I think it's about 3 years ago, to start an organization again.
Mm.
And we were cluster heads. When it gets too much work and they see it's getting too big, a
Mhm.
project, they tend to fall off, and that's totally understandable.
Yeah.
So in the end, I was standing there just together with another person, and we two of us couldn't start an organization. Just the two of us, it would be too small, and it would just crumble into nothing. So I got the idea of making podcasts, and she made a podcast, and then we were gonna make a podcast together. But because of her health, she had health issues, and she had a podcast already. Then she didn't want to do the project. So
Mhm.
then I thought, I'm just gonna run it alone. I'm just gonna do it. So, but it was my idea. I had made a logo already, and I had made everything ready. So for me, it was just to press on the button and start the podcast. Actually,
Yeah.
yeah.
And for the episodes that I didn't understand, like what are some of the topics that you cover?
Well, it's actually the same content in the. Well, I had one treatment methods in
Mhm.
English, and I had the same one in English, and that's actually
Okay.
just almost a copy. And the sisters episode, that's a kind of a summary in the end.
Yeah.
So that's explained, and also the beginning, the first episode I had, that's also half of it is in English and half of it
Okay.
is. So it's actually explained in English.
I didn't know about the first episode.
There's nothing hidden in Norwegian there.
No, no, I was just like saying
Yeah,
like
oh, you're
you can
talking about strange language.
I do follow some words. I think because when we were translating certain things in Norwegian, there are some words that are similar to Dutch, but then
Yes,
my Dutch isn't the best. So
I can actually understand some Dutch. I understand German, can speak English, of course. So, and with Norwegian, so I can understand quite a lot of Dutch, but I would never dare speaking it because I couldn't.
I think some of the words are difficult. I haven't like even reading. I haven't been to Oslo. I've only been to Tromsø.
Yeah.
Uh, but like even reading there and some words are similar. So I was just wondering if, there were other Norwegian listeners there that were curious about the podcast. But listen anyway, it's called Clusterbuds. I will leave a link below in the description. Anything else did you want to speak about that maybe we haven't covered?
No, I think we've actually covered most of it.
Any message you have to
Well,
listeners?
I think the most important thing is if you are experiencing your first cluster headaches attack, or you're wondering what it is, get into support groups. Get into support groups and get a good neurologists. That's like the key things that I would recommend somebody who's undiagnosed or in the start of their career as a cluster head. Get involved in support groups and gain as much knowledge as you can about the condition and about the treatment options that are around. There are different treatment options in different parts of the world, so it's not contained in one country. Maybe you can go abroad, check out if there's anything there that you don't have in your country, and just get some community around you. Feel safe, not lonely.
I couldn't agree more. I think
The psychological aspect, of course, to try to get the psychologist or psychiatrist as soon as possible, because it can be waiting lists. It could be years of waiting lists for
yeah,
this. Hmm. So just I get
especially
started right away.
especially I think like Western Europe, any place where it's covered by insurance, I think the waiting lists are super long. Well, I would say both, like community support and
Oh,
psychologists
and
therapy support. But I think in terms of like, I think already having just one other person or another cluster head already helps it so much. But the community aspects of, just think like just talking to someone who understands, just venting frustrations, or like you can in like communities, you can just complain and people will be like, yes, we hear you, we understand you. Yeah.
it's not enough. And I think also you get to get knowledge about things that are not out there for the public to see.
Yeah.
like alternative treatments, for example. I got
Yeah.
into getting to know about mushrooms, for example, at
Mm.
a stage in my clusterhead career. I can't use it because I use lithium.
Yeah.
So I can't use tryptamines, but I have a tattoo of the tryptamine molecule there, you can see.
Oh, no.
So,
And Eileen, yeah.
yeah, so that's close to me in many ways. I tried out that and it really helped a lot for my customers. And this is things that you don't get to hear about if you're not in support
Yeah.
groups. Yeah.
And also including like when not to use it and,
Yeah,
how.
and how to manage it. And,
Yeah.
you can't just to go on the street and buy something, just take it. So you have to know how to do it.
Yeah, exactly. So to anyone listening, yeah, do not do that. Do not try this at
No,
home.
no, no, don't. Do not do that. It's illegal also.
Yeah. So don't do that. But again, I think the key point is that there are a lot of alternatives that are being tested that have shown various degrees of efficacy. And I think we should all, come together and also just advocate for more research.
Advocate for
In the
research,
Netherlands.
not
Yeah,
advocate for the use of it, but advocate for
it's
research
more
on it.
research. So I
Yeah.
know now the Netherlands, I think they just started April 3rd, I think, an LSD trial.
Yeah.
Uh, yeah.
Fantastic. That's
So
fantastic.
that hopefully by the end of the year, there's some preliminary results.
We can blame the 68ers of the criminalizing all the substances that we could use as medications, actually.
Yeah,
So,
exactly.
yes.
Yeah, the recreational users,
Yeah.
wherever they are.
Yes. Whatever it is.
But I think that's a great message about community to end this episode on. I think
Yeah.
the standing message, I think wherever you are listening, you are not alone. So
Not
yeah,
alone.
let us know in the comments. Of course, if you are on the My Clusters app or newsletter, I will be sending out regular updates and news. I will leave the link to Clusterbuds as well. Join the Discord. I will also include links to Christine's podcast and the Instagram link. If you want to reach out to her, show her your support, thank her, whatever it is. Uh, yeah, Chris, I think this was more than we planned, actually. We covered
Great.
a lot more topics as usual. Great chatting with you. I think this was, thank you for sharing your perspective, your personal stories, and for being so forthcoming with your journey, your challenges, and also how I will say this again, how you're championing the cause of cluster awareness and advocacy. Uh, Thanks. And yeah, I will chat soon. Thank you.
Thanks so much for having me. It's really nice. Thank you so
All right.
much.